we're going to show you a technique today that can encourage a posterior baby to turn around to a better position. In the pelvis, if you draw an X in the pelvis, babies come out of mama's best if nose to spine is on one of these lines. So babies really aren't straight up and down, they're more like this. If the baby's spine and the back of its head is in the front, it's much more comfortable for mama and for baby. If the baby's head is here in the back, you can see we think about having joints that come in from our legs, but we sometimes forget that we have joints in the back of our pelvis. And a lot of back labor is the crushing of the sacroiliac joints. And if the baby's head is back here, there's a lot more crushing that happens. There can still be some back pain if a baby's in a terrific position because you have a grapefruit in your pelvis. But besides that, what we want to do is encourage that baby to be in the best position possible. The first thing I do is I ask my mamas, where are you being poked and kicked? And this is a question from spinningbabies.com. Gail Tully is the developer of that site. Lots and lots of good information at spinningbabies.com. So where are you feeling your baby poke and kick?
Mainly right here and then way down low.
Okay, so kind of in the front here. Now, can you see that if we have poking and kicking that's happening in the front, that's where the feet are. And the opposite side of where the feet are is where the head and the back are going to be. Here's another thing that I have learned, if you'd spin around for me. When I rub across the back of a mama's pelvis, if the head is in the back, you can often feel kind of a hard spot. It's not super hard, but there's a bit of a lump. There's a bit more pressure that's there. Okay, and I feel more pressure right here. I feel that lump here. I had you reach back and feel that earlier, and you can feel the difference between the two sides. So, Jana's gonna lean over the counter. Now I like to have mamas bring their arms back just a little bit so that there's not so much tension across the back. She needs her feet nicely spaced apart. Spinning Babies talks about balance and about gravity and about working together with the pelvis to encourage the baby to turn. This is not a technique to turn a breech baby into a head down baby. This is a technique to encourage a posterior baby to gradually circle around. Babies move clockwise. And so in order to get this baby over here, where we want this baby, we're gonna do some motion to open the pelvis so the baby has a chance to turn. Many posterior babies are in that position and stuck in that position because they haven't had the opportunity to get out of it. In order to do this, we're going to tip Jana's pelvis at a 45-degree angle, bring it back to center, down at a 45-degree angle, back to center, down, up, up. So you can see why I call this a figure 8 maneuver. Now, it's sometimes a little hard for mamas to do this all on their own, so I like to grab the sides of her pants and really help to lead. If you're in a hospital setting and mama's in a gown or there's nothing to grab, you can use your hands like this, where you encourage still by doing some pressure. So how are we going to get that 45-degree angle? Well, Jana's going to take her right leg and bend it deeply while leaving her left leg straight. Then we're going to come back to center, and she's going to dip her left knee and leave her right leg straight. This is a little hard for mamas to actually do because they want to just kind of dip and rock back and forth like this because that's not uncomfortable, but that's not a good 45-degree angle. So another thing that you'll notice is the side where the baby's head is located is stiffer, and it's more difficult for mom to move when the baby's head is on that side. That's another confirmation for me of when the baby is moving and where the baby's located. So let's go with your right leg. Bend your right leg. Oh, beautiful. And then dip down here. Now see, you're dipping both sides. You're just going to dip one. Dip. Can you see how a little leading helps mama here? Okay. Okay, now what I'm noticing is that suddenly, can you see this? How her right side is looser and her left side is stiffer now? Did you catch that on the video? So my theory would be the head has moved to the left side. So I'm going to check that by rubbing across. This same spot where there was stiffness before feels a little like warm and squishy, like there was some swelling there, but not hard anymore. And I find the lump right here. So that motion helped Schnookums move from here to here already. Now let's get it the rest of the way. Dip. You can see this is a nice slow motion. If you do it too fast, you don't really get the work that you need done. Ooh, you're moving pretty easy. Here's another thing that I've noticed. Hang on just a second. When a baby is in this position and mom is leaning over, you can feel this little hard lump of a head. That's another thing that I'll sometimes use to figure out whether or not the baby is posterior. So the baby's in a posterior position, it's mushy up here in front. If the baby is in an anterior position, it's hard. So let's, may I? Let's feel and see. Oh yeah, yeah. Okay, reach down there and feel.
Oh yeah.
Now feel the other side. Feel it squishy on the right, but you can feel firmness on the left.
Right.
Now, how did I know to check that already? I knew because I've done this enough times that when I moved on the left side had loosened up and it was smooth to do this maneuver on both sides. Baby has turned all the way around. Okay, so stand back up. How's your belly? Feel better?
Mm-hmm.
Is it bigger? A lot of times mamas will stick out more. Posterior baby can, the belly just doesn't poot out as much. And so lots of times you'll see after a baby has turned, mama's belly looks bigger. Walk around a little bit, see how that feels. Is that better?
Yes, much better. It's not right here anymore, in my butt. Yes.
Now, sometimes it works as easily as that. This was a pretty quick turn. Sometimes it takes more maneuvers. Sometimes the babies get this far and then they won't move all the way. So we'll show you now one more stationary technique that you can use to help open up the pelvis and encourage the baby to continue to turn around. This technique is also listed on the Spinning Babies website. I first learned it from Dr. Sean Manning, who's a chiropractor in the Chicago area. And Gail Tully learned it from a friend of hers who's a chiropractor as well. Mama lays on her left side, and we're going to hang the right leg forward. So it's imperative that Mama's on the left side, because what this technique is going to do is close up the right side of the pelvis and open up the left side of the pelvis, giving the baby space to turn. Sometimes when I do the figure eight, a baby will just kind of get stuck here and they just can't make it all the way around, and I'll say, okay, well, let's try this technique. So Mama lays straight up and down on her left side. She obviously needs a spotter right here in front of her. So I often straddle her belly, and then she's going to take her right leg and drop it forward like dead weight. So this is reshaping the pelvis. I'm going to hold onto her with my arms and move so that you can see what her position looks like. But you can see how she needs a spotter in front of her. This can happen on a couch, it can happen on a bed, it can happen with a mama with an epidural on the edge of a hospital bed with a good spotter. It'd be a good idea to run this past the nurse that you want to do this technique before you actually do it, because if a nurse walks in and sees a mom and fallen off the bed, it'll kind of freak her out. But if you can explain that this is a technique to turn a posterior baby, that's a benefit. So we just stand here for a while. Occasionally, I've done this with a mama that I've done figure eights, and then I'm standing here in front, and all of a sudden it's as if the tension in her belly releases, and sure enough, Schnookums has turned. So this is another possible way that you can encourage a posterior baby to turn.